Kia ora koutou. I'm delighted to have Dr. Olivier Caunes with me today to talk about his experiences with patients with ME/CFS and long COVID. So welcome, Dr. Caunes. Do you want to start by introducing yourself?
Hello, Kate. Thanks for having me. I'm Dr. Olivier Caunes. I'm a fellow of the Royal College of GP, and I've been in New Zealand for now 6 to 7 years. When I was in med school, I had done 2 study papers regarding scientific topics with biology applied to cellular DNA and also endocrinology. I've done a bit of GP work in France and also being a humanitarian doctor for 5 years with Doctors Without Borders. That's about it.
Fantastic. That's a great background. So can you tell us a little bit about your experience working with patients with ME/CFS and now recently probably more long COVID?
It's been a discovery first because you're not really taught about it. So you need to self-educate and be really listening to patients. And it has been the last few years, at least weekly cases or daily cases of patients coming with fatigue symptoms. And with COVID, the post-long COVID is something which is really a thing. And it has been on the rise. So I need, as a doctor, to keep myself updated on what's going on there because it's really starting to be a problem for many patients in New Zealand.
Yeah, that's really tough for so many people having had COVID and ending up with long COVID. So coming up in May this year is World ME Day, and the topic for World ME Day is Learn from ME or Learn from Me. And the subtopic for it is post-exertional malaise, often called PEM. And PEM is one of the defining symptoms for people with ME/CFS and long COVID. So I wanted to see from you what your experiences with patients with fatigue and post-exertional malaise is, and what do you look for and what sort of tests do you do?
First, you listen to the patient. Most of them will come with an idea of what's going on. And it's true that when you take a detailed history, you have all the symptoms coming up, like, oh, I do a little walk and I'm exhausted, doctor, or I just sit behind my computer and my brain fog is massive, or I have all sorts of symptoms going on. So I started to have a kind of detailed list of symptoms you need to check for, like also dysautonomic symptoms, where the blood pressure is going all over the show with some postural orthostatic tachycardia syndrome, the POTS. That could be a big part, or some IBS type symptoms. Even mental health is impacted in that. So you need to explore, and I need to explore every aspect of the person and as a whole, and her or his environment. So according to the findings of the clinical examination and the historic taking, I test, meaning for sure, I will take blood pressure sitting and standing. For sure, I will do some blood tests to check if there is any weird things happening. Even sometimes you can have underlying conditions that are promoting even worsening symptoms. So it's really important to test every aspect of what the patient is talking about. And from there, you can refine the diagnosis of what's happening for them.
Fantastic. That's great. And how do you assess a patient's experience of fatigue, and how do you gather the impact that it's having on them, how bad the impact might be?
There is the physical aspect and there is the mental aspect. Physically speaking, as I just said, just listening to them, you understand that something is really wrong. Like you have really a professional which were able to multitask, which were able to be working 10 hours, and suddenly they go from that level of functioning to really below the sea level, and you say, oh wow. So the assessment in itself start to be obvious if you listen to the patient. So there is here a list, as I said, a list of symptoms, and from there you can assess the impact it has. And the main one also is mental health, because the patient had a life, and suddenly the life is completely gone. and that has a huge impact on them. So it's also really important to assess that.
Mm. So it sounds like looking at what they were able to do beforehand to compare it to what they're able to do now is a big factor in diagnosing it and knowing that there's something seriously wrong happening.
Absolutely true. The dynamic of the symptoms is something, the evolution and also the patient view on what's happening is really important to take in account.
Awesome. So what works? Like, what sort of things do you tell your patients that they need to do to help themselves? And then on the flip side, what do you advise them not to do? What doesn't work for them to help with their fatigue and post-exertional malaise?
Pacing, listening to oneself. If you don't listen, you will end up in the same situation all the time, again and again. And that's what doesn't work. If you don't listen to yourself, meaning if you have suddenly you can't walk anymore, so stop walking, stop what you're doing, call it a day. And that should give you a bit of an understanding on what you can do and what you cannot do, what is the limit, because as soon as you're clearly defining your limit, you are able to work within this limit. And it's what I usually say to the patient, this is the beginning of the empowerment. The situation is seriously disempowering. You had your life and boom, it's gone. So now, in order to reappropriate or to take over again what the control of the situation, you need to pace and listening. And if you have any symptoms, some patient will be like more suddenly I get all these hives, suddenly I'm feeling super tired, suddenly I get a massive brain fog, call it a day and rest. If you don't do that, you will go backwards each time. That's usually quite clear.
Cool, awesome. Yeah, pacing is amazing. Works really well when it's done right. It's very hard, but it does work.
Absolutely.
Is there any other advice that you give them?
Supportive environment. It's really, really, really important. Usually most of the patients tell me, I got a team now. And it's true. They have to have a team in order for them to feel that they are supported and they are not alone with their own problem. I'm really happy for the ANZMES support group to appear and to be able to tell the patient, actually, there's nothing wrong with you here. That's something which is happening, which is wrong. And that's really important to feel that they are not alone, and they have actually people that they can turn to who have either similar experience, who can orient them in the way of care. So it's super important to have this team around them, because it's life when you lose it the way it was. It's really a big distress for them. And so that you need to help them to find their supportive team. Yeah.
Yeah, fantastic. And that's a lot of the work that ME support does. So yeah, if there's anybody watching this who needs it, then feel free to reach out to us. So what advice would you have for other medical professionals who haven't experienced ME/CFS or long COVID and have patients that are coming to them presenting with fatigue?
To have what they usually really good at is to have an evidence-based approach, because there are a lot of documentation that they can find online. And there used to be a page of the Goodfellow Unit, which was about chronic fatigue and ME. And it was already advised there. It was there, B12 injections, CoQ10, pacing, investigation, all the different codes that can influence disease. So the evidence-based approach is really important to gather all the tools that the GP needs. And usually when I was educated, there was no such a thing as a chapter on chronic fatigue syndrome, because it's such a multi-layered problem that you need to investigate all of them. So it can be quite overwhelming. And also they need to take their time. When you have somebody coming with chronic fatigue syndrome, it cannot be resolved in 5 to 10 minute consultation. This is completely not possible. We need to sit and listen, and to give them also, either if there is no way that the GP can understand or help, they need to refer to the ME support group, for example, who will be able to help. So the main thing, there is room to, like every year, we receive new knowledge about new treatment or new diagnosis. It's the same for ME. We need to update ourselves according to our practice, and I think it's a learning curve, and GPs are really good at that. They are learning every year. They have to keep themselves updated, and I'm sure ME support will be able to provide that type of knowledge on what works, what doesn't work, and I think it's really important.
Cool. So if a medical professional has someone with really bad fatigue and PEM, you know, some patients are housebound or bedbound or what have you, do you have any advice around that?
Yeah, wins. If they can't walk, can't work, and so on. First, we need to support with the wins. It's something that GP does no matter what, with according to the impact of conditions on their lives. Also, if they can't really move freely, parking help also. So the main thing here is to be able to actually support the life of the patient in all aspects. So it's really important that we have that ready for them.
Cool. Is there anything else that you might want to add around your patients with fatigue or post-exertional malaise, or for other medical professionals?
There is hope. There is hope. There is even if the situation is tough, there is hope for sure. Patience. The main thing is that you will build up more and more ability to go back to your previous life. And the number of even like I had the other day, a 19-year-old male who went on a holiday, had a severe infection, and was hit by chronic fatigue syndrome massively. Studying for him was hell. Like, actually, he had to have some medical certificate to be able to do his job. Now he's 23-year-old. He's back on track. It took him 4 years to understand everything, but he's back on track, and it was a horrific situation for him. So hope and pacing and to find support so that the situation improves.
Fantastic. That's awesome. Okay, well, is there anything else you want to add, or?
Well, listening to the patient as a GP, no, it's that there is hope. And I think that there is a great work that the ME support group will be doing for all of these patients to let them know really ME, CFS, long COVID is a thing, and that they are not imagining stuff, and that there are people like you who will be able to hear them, and that's what matters the most.
Awesome. I really appreciate your time today. It's fantastic to chat to you, and love the work that you do. It's amazing, and I know that your patients get benefit from working with you, and so hopefully other people who hear this video can get some benefit from hearing your point of view. So really appreciate your time. Thank you so much.
Thank you for your feedback, and you're welcome.